le taiao mamalu. Taiao tutoa. Whaftai ua lilo utumau. Ai aliali utumaa. Ilo tau soifua, mlo tātou ola. Ule ai foi se bea li ai maunga o ni ua. O se mala ya fea lo tau soifua. Misio tātou ola. I le lofa balanga le leo le atua. Lele wa sua vai longo la. Tu lolo vai lepa. Wata tafe a lia le alofa leo le atua. Utu bapu le vai utufia. Tātou whiloa i le au au. O le atua. Ai le o afuafu matangi. Vi i ai pealo na alofa. Malo nanga le lei. O le mea lea. Le tai au fou bala sa fou le fio bai o la wa fioga e presidente. Sui presidente o senat. A mese le mamalu i a fio a fionga. Seintoa le mauta mawalunga fona la fona brik Samoa. Ta maa matinao le atu. Fa malo soifua. Fa malo le langi mama. Tāo le nei na tupo ina. E ale lo longa i peo le silafia. Le foi was su mai matala mai au. O tātou boli bau. Me le vala watuai le ava bal whalao le tele lau. Lau suga mao lau fioga le prestoa. A sentoa. Sau dia si tatalo. A matai le tātou wha boi le yasfo. Malo avala waftai.
Tātou talo. Ua whaafonga ina e lau fio lo mātou atua. Ulua i mana onga pe ona tu ina atu le nei tae i ate o lo mātou tamā. O la ngona uma fo ina o tamā o le maota ma tina o nei maota. A mātou vi i aile siri ese o lo walofa ma lo wanga le lei. E ala i lau pule whaasoi fua i le ola ma le malosi o mātou maua le nei tae. E ui ana le tusa ai le tangata i lau sila whanga lo mātou wali ia. E pe tai wale a vea o mātou whale tonu. Ma ala e o mai ai au whamanuianga ia i mātou a wālo walofa tūnoa. E whaasa lafa ai so si tangata. Mātou maua manuia ai nei tai au fau le alofa o lau fio. Po ia tuai le vi inga ia te o lo mātou ta māwhai mea siri. O mātou mawaili nei tae au ili manuia mai a te oai. Mātou wala au lo mātou atua. Tau al mangalo nei aso mono fua fuanga. Mātou tu ina atu o mātou wha moe moenga ia te oai. E te tali mai ili nei aso. I umal manuia mātou fua fuanga lo nei aso lo mātou ari ia. Maua se vi inga o lau fio aile o mātou tangata. Mātou talo ia te oelo mātou atua o mātou se semo mātou o leo. Lofa wha mangalo i mātou toto lo walo Jesu Kerisha. Amen.
Whaftai tele, lau fionga sintoa mole, tal sanga baulia nei tae au. Lofa le tua fuaile. Mero faltido sisili da ganga. Sau ni e pia mbonga luenga. Tofi ai lau fio. Ai vala watu. Ma le whaaloa le tele lava. I lau sunga al fo mai tu elu sega. E ta i fono komiti whaafoe el whalba. Pes whela o fio al whaatolu bot sa nua. Talane au le tu lama le. Wata seba le tatou. Medical team. La foi pio vai malui mai tai tau sbai ya tai o vai nga ten for mai Misi foile. Ifo ba suigo. Good morning, Bula. And talofa to our distinguished guests this morning. On behalf of the President of the Senate and honorable senators, members of the Senate Standing Committee on LBJ Hospital and Public Health, I would like to welcome you all this morning to this very important Senate hearing. We are so happy, fortunate to have you this morning. The Senate Committee understands that with the respective positions that you hold, you are the leaders of healthcare in the territories. And that's the truth. The Senate understands that tough and difficult decisions have been made going forward. And the Senate applaud and appreciate the character of your leadership, in which such moral decisions and the courage that you have resulted in such positive and constructive decisions. This morning, there is no intention of this committee hearing to go back about what happened in the past. But we must go from here, going forward. And we'll give the time now to the chairman of the board, Dr. Joel Sepp. First, to introduce the hospital leadership team, the new leadership team, to the honorable members of the committee. And then we'll have you address the Senate this morning.
Yeah. Okay, Maleava. Okay, Kakala Maleava. Malpalo. I Paya Masui, Pakalo Pakway. Male Ranga de Omai. Ranga Pakai de Omai. Kalway la oingas haluka kaulealo Samoa. Sa ili lava I whamangianga ma popo inga mai ka maa ma ki ngā rakungu. E ngā whakaila, ai e luku hanga paleo le sunga ia el foma i o kapusi le tua. O ia le ua kofia CEO, active CEO, assistant o I active CEO. Ngā ke kaua vea le le kulanga le executive. So koe longa I kui o le sunga ia Dr. Joseph Shamway. O ia le woko fia le foma isili o le Chief Medical Officer. O se sifo I ua salawi ko luma ia longa profile malke longa whaia. Ia o le ko finga ia sima, ko finga po ia ko ka ia ka me ka eima ali kausi mai. Ia male ko finga po ia lele o ka whaia po kalama I polisi o ken kausi mai. Ia malsui lango o ko miki whapoe le ko finga po ia Dr. Gene Anderson o o mai. Ia malo ku kampaile le sunga ia moksa le whakong fu I o le soifo maloloinga. Pele ko whinga ia Makerika, Margaret, Riolo, ka ia ho ia kameka I kausima, I mari kausima. Ia, Marco Singa I Fomai, ia ka ia Fomai I Department of Health, Elizabeth Lauvao, mau parot kili.
Ia, paftai tele lau sugal formai tai o committee fa foi. Na si bella vale tasi fa pulat fa bulbul. A fai wa sa si le se bato fa aliga. O le tare le fa boy bole fa mai la vaia. Palu lua tuai. Ia ma tai fo fa mai. Alias for ele fa mo mole. Joga le fa tolu ya butsa. Ia ma ranga le POH. Pete iane le ua fatasi mai fatasi talongona le a faina lea. E fatanu pel tatu ilo longa las freile fa bulbuli. Ai neta ya se tatu fa longa fatasi. Ala tu le loa il falma. Ona o tulanga ta ua lo ta otto e dei na ia fa fitauli. Se tatu fa longa fatasi le fioga le fetot. Ai se isau no ala tu tulanga wa nei sa sui fo malanga iluma le ua malu ia fionga sentoa ta ba ma titala tu le ua o fai lo mai ia I la tu ia tai fo lo I to fia vol tatu ba ta kaskas o le sugal nai le tai fo le komit fa foi len sa no ia o fo bai le tua vale lo na tua vale o le CEO na mo nei temi le acting CEO Dr. Lentua Akapusi. And then the new chief medical officer tato for my silila lewa to available tofi Dr. Joseph Shamrock.
Chairman, so fa'alaka tatu lau sungo te komiti. Na ua e saungoa o le ilonga le tae nei o le vanga le whalemai. E taunga whaamalolo le vanga le public health e o whaia lātou ngā luenga o pisi fo I lātou o whaavanola lātou o sa waleile I mō lātou. A le ilonga le tae nei na le vanga le whalemai. An mele watu le whaftai lau sunga le whaatonu o le public health. Le ilo tō wapanoa le asa waleile tatu e whelua e le tatu mauta. Te taltonu o lo pisi fo I o tō ia tō ngā luenga.
Tai atu me sili wa mawane no tato felo e nei tai o lo ma walunga pel masina ta mama tina ole lo tunu ala tato to felo ai las foye pe apure lo fa le tua ia manui ala va nei tai o man fa lo alo
alo faftai now we give the time over for the chairman of the board to have the new acting CEO and also the new chief medical officer to address about what they feel about the situation and going forward at the hospital and maybe their vision and the new mission. Le la tatu fa foga ile tai o fa bai CEO mo san saudanga wani tulanga foi o mafafawina e ale anga ilu ia fa pena foi fo mai sili e suga ia Dr. Joseph Shamrock.
Thank you, Honorable Chairman and the members of the Senate Committee. LBJ Hospital, as you all know, is the only hospital on this island that takes care of our people. The mission of the hospital over these years is to take care of our people, is to make sure that we provide the care that is of high quality, that is safe, that is comprehensive, and one that is affordable and our people need. And that is the mission and the vision of our hospital, is to provide that care that meets the needs of our people, but of high quality, safe, and comprehensive.
Thank you.
moving forward from here, is to focus on that mission that we have. Right now, there are a few things that have already been put in place. There are a few critical issues in the hospital that we have already addressed. One is the shortage of nurses. At this time, we have already secured 2 contracts where we will be getting nurses from the Philippines to come and build up our staffing shortage in the nursing profession. That is one of the critical issues and the need right now at the hospital. The second critical issue that we have is the waiting time in the emergency room. Waiting time in the emergency room, we have already addressed that by starting our non-urgent clinic that is open during the hours that the emergency room is most busy, and that is after hours from 4 to 8 o'clock, and also during the weekends from 12 to 8 o'clock. We are addressing those needs because those are the critical needs as of now, and we are evaluating the waiting time in the emergency room. This Thursday, we will be reviewing the function of this non-urgent clinic to make sure that we are meeting the needs of the people, and that is to reduce and minimize the waiting time in the emergency room. And if there is any need to modify or to change or to expand that service, we are going to do that. We're going to modify the opening hours so that we can meet the needs and address that issue of the waiting time in the emergency room. For the other services, I will first start with the clinical service. I am grateful that we have brought in Dr. Joseph Samoa, who is the new Chief Medical Officer, that we are working together right now to address the clinical issues that we have in terms of our patient care. As I said, as physicians, we are looking at producing and providing the care that meets the mission and the vision of the hospital. And with our nursing issue, together with our nursing issue, we are looking at addressing those needs right now. Moving forward from here, as far as clinical is concerned, one is our human resource personnel, improving the personnel, the physicians and the nurses. As I said, the physicians, we have been recruiting our physicians. We are looking at getting our physicians at 90. We have been recruiting physicians right now to make sure that all the services and the needs of each services are met with our human resources from the clinical side of things. There are a few processes that we need to put in place in order to build up our medical care at the hospital. Those processes have been segregated for some time that we are now putting in place, and I'm grateful that we have brought in our new human resources director on board that is helping us to put together policies and procedures and processes in place to help us lay a good, solid, and firm foundation that we will build up our medical care in the hospital upon, that will be sustainable in the long term, and a process that will also connect all the services that we have in the hospital. And this is from the clinical side, the work of the doctors and the nurses to be connected together with the work the finance and the human resources. We have also contracted a consultant that will help us tie things together as far as the finance is concerned. That is from the clinical, tied together with the human resources and with the finance to build up, as I said, the goal here is to build up a good framework and a good foundation for the hospital so that when we build up our clinical services, our finance and our human resources personnel, we build up on that foundation that we have already laid that will be sustainable in the long term so that we do not face and go through the same problems that we are facing right now.
Thank you. Ole, saunonga nale. Ale CEO fo, ole pulel felbai, itagalwenga tau felbai. Ole, sirigia ole aso na yana fufanga mole anga iluba. Ya, nana fa fo ia ia lan saunonga le membo mo lo hatu ngalu ia ole le lava te fo ba. Paulo o taupa whai e fo ILM tau le temine. Whapena fo i fo mai. O lo o ngā whai la tō malme tau puta ua lea. Mua o lo o sioki pete fo mai. Ia fo mai o lo o tau whai la e recruit e haia mai. Whafo le temine. O le melo le rua o le umini whaatali o mai. Umini whaatale o mai tōru o whale mai e li vai e. O le stasi leo whaafita uli o. O lo o tau whai ele suga le si o. E fōia, e moni. Lo tau whai lai, tau whaisi swinga o tebi fōi le e sa tala ai. Ia tātou tala vai. Pe matea. E esi swinga fō e le bei le tu la. Ale. Tu langa al ele tausiga o mai, wal vainga o mai, tōrolo, wal whale mai, clinical. E tala tuai aoi, emergency room, ia ma o medical clinic, surgery. Ina fo ia o loo, o na ina la le o, tam whaite le aile, i lato le e wha, le leia. A mata mai le tebe wha le mai. Se o lava o na, le vaia e fo mai. O le tebi siri dana tāua i tāua na whaalelea. Leo tau mwhai eile. Ngā lue whaatasi da ia koneti umai a vaenga SS o whale mai human resources, finance, whapena ia ina e whai se framework se tasi se o se whaingai tasi ina ia tu whaatasi. Saunanga le suga le. Si o ne tai au molet lo tau whai ele tatu amatanga fo whaftai te lau. Thank you so much, Dr. Lentua, for your presentation. Good. Yeah, o se whatu lef sili.
Nei ole,
Fiogale.
o to sanga lo fiongale taje kumich.
Yeah.
E le se va no e mo ele na filingia ia. E Dr. Lentua CEO. Wa le ko mai ala tsaunga, le foi ta ku maramlama. Ina tsaunga ngale fai mai.
Yeah.
Ale yo atu seisi. E pe fai ngo fiatu na. Ia mai a saunga ngal sunga fo mai.
Yeah.
E o ta sanga le lo fiongale taje kumich.
Tai atu ba le fautuaka wale lei. Tu a pe yela blo. Dr. Lentua. Yeah, the questions are coming to you. Give it a chance for the members of the committee for the questions. The new CEO. Yeah.
Good morning, ladies and gentlemen. Dr. Lentua, you are a medical doctor, right?
Yes.
That is your profession.
Yes, sir. Yes, sir.
And as the CEO of the LBJ, how do you expect to, have you had any experience running the hospital?
I have been the CMO of LBJ from 2012 to 2013. I have just completed my master's in business administration with emphasis in health system management. and I'm waiting to graduate in May.
How long have you been working here, LBJ?
This is my 21 years of working at LBJ.
21 years?
21 years, that's correct.
Then you should have an understanding of the inside and out of the LBJ. I'm glad to hear what you just said this morning about the emergency room and the intention and what you're trying to do in order to improve the service for our people. And that's the reason why I'm asking you, because my understanding that you are a medical doctor, and I guess you're banking on your experience here in American Samoa for 31 years that you've been around LBJ. You should be able to know what's wrong, what's right, what you need to improve. Listening to what you just said this morning, it gives me some insight of what you intend to do to improve the service to our people. Let me tell you something. I've been to emergency room in the last 3 months, and it's the worst and worst service that I ever seen. I've been in the emergency room for almost about 8 hours before a doctor was even I was able to see a doctor. And I'm not just talking about myself, I'm talking about the people, the public that comes to LBJ. That is still frustration. Spending hours and hours in the ER waiting for a doctor to see them. And that's not good at all. And I hope what you're elaborating on this morning, that we should be able to see some improvements at LBJ. The service at LBJ, to me, is not even close to 50% to our community. And yet we have spent millions and millions of dollars every year at LBJ. I will reserve my remarks. Maybe I have another chance to say something later on, but I just want to ask you, because I know you are a medical doctor, and how you're going to run the hospital as CEO. Chairman, after that.
After e pela me mo fisili mile suale ya la fionga fonti se to ya to me sol fionga sa tele
mo o pa to lo watu pa ia mal malu pa fionga kama le tu no wasina o loko iai le moe tō whaalo loko. Tōnu mauta nego. Pata lofa. Mai se lawa fionga kai komeki. Tuia singa. Pata lofa fo i malu mon mam. Wa fio mai ngai kai fo. Sui wa ai mau tanga se sui wa ai fo iam mai le tuan tofian e tausi le soi fua ma le ola ma le tiele o tau tanga ta uman ma lo Amerika Samoa le ma lo Amerika Samoa ai sia le angan o le soi fua ma le ola, e a mai le akua. A mai le akua. A le kangakan, ngā luen kofi ngā le akua. E a, la me whain, soi fua ma le ola. Pa mua soi fua ma le ola. Pa a le nganga. A mua pa le nganga. Ma lo si lo kinga. Malo si lo kiu. Mea, oa, kumo au kele o si. Kele ngau o si. O le si mo mua, ko sunga, ko fia ngaka, Amerika mua, o wha mama ya koko. Wha ma koko. kong fan maiam fia la fa ka fa makoko.
The question is how many patients are being dialyzed at the moment. This is her question. Dialyzed patients.
I don't have the exact number, but I think it is 170 plus right now. But as I said, that is not the exact number.
170 or 70?
170 plus altogether.
Salauf is full.
And the total number of patients, there are 31 chairs altogether that are in the dialysis that used over three shifts.
Okay. Salauf is full by beal so belasi do bel anal tolsu tasi no foa. Ya o wa ye tangata ye leaso maleaso lvaiaso it no foa ye tolsu tas salauf is full ya ma yo fa mato. Salauf is full.
Okay. Salauf is full. Kalo fai. Ore siop si long luan me. If you are machine fa mai koko.
Tolu tasi fa bol le wa fioga sol tolu sul tasi basili le o wa ye tangata ne salauf is full. Tolu sul tasi.
Ele outdated machine yam. Ele outdated. O ang kautanga nga o kai machine yam.
He's asking about if the machines were still outdated, but they're not outdated. How many years since it has been in use? Approximately how?
I think these machines, I'm not really sure of how many years have they been working. I know it has been for at least 5 years, over 5 years.
Lima tausanga masini le dei. Peba lima tausanga. Wow, isi masini ba isi melis isi ya lima tausanga on masini lo ye nei. Lima tausanga.
Elanga masini wa makanga kelbisin mai fafong. E yesa pale mai o yamlik samo. Wala mai ye kang samo. Ingai ngi ifapom kumu balel ka kam benga le mal pole anga wenga le fa kom ke van ma au ka stao ajam mai le kuam le ma va bom lo roko ma va le malu am le Samoa. Malu am le Samoa. Uma kunge mako wola kuma ole kupua e fanga faial malo. Inga malo me kalisia. O me lang le la fan. O me nge. Fa mol. Ele manga wa lu vai I on ingo foa. Van ma.
Ai sau no ma lo sau no. Dai.
Ai le changal we fan. Le manga wa. Nga lu ban. Oh. Ka lo fan ele ko. Ola ofisilim, esi ofisim. Po ai o ko e local. Ian RN ikel. Ian of RN.
Ja, officieel.
Reactionaire. Ian of RN.
Ja. Tadi mai.
Tai mole sili ya tadi pupu watu fast food tasile of RN solo ye tebingi.
Ian
fast food tasi.
Fast food tasi.
Kasim. Via LPN.
LPN holo ia e tolu lua.
Tolu full lua. Todos fulu LPN, fast food tasi RN.
Fia nurses A.
Se tali mai le
O leo whai o nurses 8 o lo iai e fast food 5.
e fast food 5 nurses 8.
Kama mole tima yesi di siu yawe. Den fanya mai face kopi mali tele tato
Yeah.
me adi pasiri
Ai
ya.
o wikan. Nang o nga o ngam. Habong mai o San Francisco. Ma o ngem. Kalau fa ya ku. Nang sim.
Ja,
Kau ko nga.
tai lava le saudoa, tai lo whiringa lo whaalia lo whioga, se dua fonti, tai foi whautuanga whaatira, e tai au malo, whaftai, e tua vila mlo le whioga sa tele, alo salvasi de velos, lau si.
Te lei lawa whionga ke kai komiki. Mua a vakul whamalo i ko wala winga. Ko whinga wa ko whiaio ko sunga. Lau sunga le chairman, Dr. Tuyersenga, Dr. Ledoux, Dr. Joseph, I didn't get your last name. Shamoy? Okay. I'm sorry, I wish I had a list of all your names. Yeah, I lenga ka foi lea o sunga foi kai ka ia le nurse. Whafkai mo ngi ka hao, mai ele lava ka ko keimi. I'm going to try to ask some of the questions or concerns that we have here in the Senate. Dr. Ledoux, thank you for your service. Over 20 years, you served this community. So we thank you. The question that we're going to ask, I know some are personal, but understand the hospital is very, very important issue to our community. So thank you for your service. Being a CEO, what is the status on Bill Emsley? Is he completely fired, or is he still fired with pay?
The former CEO, Bill Emsley, is completely out of the hospital right now. He was initially on pay, but we got our legal opinion on him for a payout for what is due of him. So right now we are working on that.
Well, that's kind of open questions from your part. What I'm asking is he completely out, not on any kind of compensation?
Yes.
Or since when?
He is out since February the 4th.
So February this year, he's completely out?
Yes, that's correct, sir.
Okay, thank you for that. You know, the board have to do, sometimes you do hard decisions. The hospital have a reputation, I'm sorry to say. You know, it's some work. And so being a CEO, you know, changing the reputation is not easy. But what are some of your ideas or some of your plan to change that reputations? Because most of the people here in American Samoa, they always seek off island unless they can afford to go off island for appointments. So what are your plans for the hospital to counter these reputations?
My plan right now for the hospital is to improve the care and the services that is provided in the hospital, to expand those services. And my goal is to reduce the off-island referral by at least 70%. I don't see any reason why we are traveling off-island. When we have a hospital that we should work on building up and providing the services and the care in this hospital so that, you know, our people will be treated here on island. Not many of our people would like to go off island, and the reason why they have been going is because the services is not provided here. So my goal right now is to expand the services, improve the services, and expand the services based on the top causes and reasons why people have been going off island. And to expand those services here, to provide those services locally, and at the same time to incorporate our telehealth services to enable us to connect with our off-island doctors and physicians, but not to allow people to go, but to allow exchange of ideas and opinion from us, from specialists of island. We have tried that late last year. We are working on getting connected to Queen's Hospital in Hawaii and form a telehealth initiative project that will take care of our people here locally. We tested that in our ICU. We have connected with them for our telestroke program. For our patients who have stroke, we can connect with them directly through these telehealth services to get first-hand advice and treatment on our stroke patients. We are looking at expanding that also to our cardiology patients, cardiac patients, those with heart problem. We can also connect. That is our next step. Once we establish a stroke program, which is going on well, we are going to move on to those that have heart problems. These are the main reasons why people travel off island. So as we expand our services locally to take care of the needs of our people locally, we are incorporating technology, the use of telehealth to minimize and to reduce. I would say that if we do this well, probably only 10% of the people who have been traveling going off island right now will need to go off island. The rest of the 90%, we can manage them here, and we can take care of them through expansion of services and through telehealth. Right now, we have a cardiologist on island that came from our, as a missionary from the Latter-day Saints Church, Dr. Kada, who is here for 18 months. So he is working together with some of our physicians locally to build up our cardiology service here at the hospital. And the goal is that when Dr. Kada leaves at the end of his 18 months in here, he will not take back what he came with. He will leave all his knowledge and all his expertise with our doctors who are here, with our local doctors that are here, working here at the hospital to build up that service and expand the services. We also have an orthopedic spinal surgeon who is here, and it is the same goal that we have. When they come, when we have them, and we are blessed to have them come with their specialities. We're all aware of Dr. John Edwards, who was here in 2020 and 2021 for 18 months. And it was the first time that we did joint replacements here at LBJ. These are the kind of services.
Thank you.
Yeah.
Thank you, Dr. Ledua. I tell you what you just said, diabetes, hypertension, stroke, that's what people want to hear. But I think you guys have to work together, get the outreach program, so the people in the island will know that all these services are here. We have so much people to help. Please get that information out. Dr. Ledua, what is your status? Now you just become a CEO. I heard, without saying, that you are leaving the island. So what is your status?
My contract as CEO, I'm acting CEO, is until April. My family lives in the States. We are U.S. permanent residents. My family live in the States, and I have been offered a position as a medical director in one of the hospitals in Alaska, and I have already accepted that offer. There are a few paperwork that has been done and are being done right now to finalize that appointment before I take up that offer.
See, that's my worries. You just been elected as a CEO, and now you're leaving us. And with all this plan, lau sunga ku your senga. O lau fisili mua lava, e leo pungi saa fo ilo wa fionga e kulanga o ye falka ko falma. Le aisi whakukua inga e lea kungu. O ngā kulanga ia, le fo exit fia le leia. Or ke le fo ia o ka mama ki ngā o ngai il house ngai, o kalawai fafo. O ngā le i kat konguinga, oe, le kat konguinga le upulaia, le whakukua inga, le kako falma. A o leo e whanongongo ka o i plan a CEO, e se makangofie. Iei uma service. Ai se awa, leo e kulai mai. O lea la sau ngā yoinga, po lea sau ngā ruenga e kakau ngā fo ia i lea whawhikauri. Wa o lea ngā ngau kako, whao ngā whanma. Ia lea la le fo ua whanongongo. Ia e malanga ngei le, e uma ngei le CEO lea kako ia pilila. Ia o lea e sau ngonga e kusal mka upula.
Kai mo le sili, e mongi ma e mongi lava sa wanga e ofo ia o ke iai fo le longonga ngal ka kufalmai. A o le lukau le ia ma uo kulai, o le au kongwhai iai. O le lukai mua, o le leai o ngisi o kako kamawhangau. E kula i mai e kamawhai kulanga ia. O la iei kako kamawhangau. Alo ngā lua i whafo. O lea hoi lae e kamawhaia iai. E a hoi e o mai e soswangi. O se hoi pengo mai whafo. Soswangi mai. O le alu i luma. E a o mai lalwhinga le li i malangko whinga e kula i le sunga e alu tua. Ua uma po inga kalngoinga le mako komiki. O le ala le si me apai. Awa peong sa ngoa le sunga e alu tua. O suinga i o whai. O suinga uma ua e masaa ku i pōt. I komiki whapoe. E mankua po i ko pionga. It's a governing board. Mai e i mō po i lama ko lau sunga le fō mai, mama ko sui. I le kausuengo me iama psosangi i fō mai a wako ranga ia. Peila o le telehealth lea le Queens. Ia nga o ia i le fongo i awa i le sama wako ngai. Lea nga whako ranga i so ka inga ia ma Queens. Ma o whiawhia ho ia whan mai. I le ngaka le Queens. E whialolo ho ia isi fō mai Amerika, whan mai Amerika. O loo pia soswangi mai, langa o loo kan ngā po ia o ima Amerika i kako si mai aku. O lai pia soswangi mai, o katku munga o kako wae, kako o lai kangi, kako kangi sa moe o marima. O le salope po mangingole.
Ioe leua whanolo waku. E msalo e koe fo i aku i le se fisili lau sunga, ai whawhkai ki le mole. Ka loe o lo keimi, ko kasi ala fisili whamal mole.
Ia, la tolu le whaatali. Le isa unoa fo paisi. Paisi a Dr. Joseph Nita.
O le fia mo e lau fisili a Dr. Joseph. Dr. Joseph, briefly, what makes you want to come here to American Samoa? You've heard the issues that we have in hospital. And what are your plans?
Yeah, you have a broken hospital. It's a hospital that's been broken for many years. There are people in this room that probably know more about why the hospital is broken than I know. I am here because I prayed, and this is where I'm supposed to be. The board ordered Bill Emsley to hire me in July, and I was not able to get on island till February due to delays and obstructions into my hiring. The question is, what do I think, why do I want to be here? This is where there's a tremendous need. I've done this type of work before. I've done this type of work in China, done this type of work in Arabia, where there were lacking facilities or no facilities, and we built high-level, high-quality, reliable health systems and provided that for the people. America Samoa has faithful people. I believe they pray. They pray that God will bring and fix their healthcare system. And I believe their prayers have been answered. I will tell you that I sat with the president of your Senate in the governor's office last week. We spent an hour, and in a very soft way, we talked about what was needed to fix your healthcare system.
Okay.
We hope that the governor listened. Now, let me just tell you that there are many things that we can fix, and I'm here in the softest and the kindest way to support your Samoan people to fix it, if people will let me fix it. We have the right people, HR, finance, and we want to do it.
Okay, thank you. I will get back to you. I have more questions for you. Yeah, for tight over.
La fionga I sento out. Umanoi.
Te tu ni tai out, te tu lo fionga te senga, te committee, before you speak is a committee, and the distinguished members of the boards. Also the CEO, the nursing director for this morning. I echo what Senator Satele said in regards to the good work that you're doing for the hospital so far. But I kind of sit back and kind of sorry that Dr. Latua is leaving in next month. So I don't know how we're going to carry this role. We have we heard what you put out for your try to put together all the pieces that you will try to get good healthcare here in regards to the human resources, CFO, in order to get the money in to make all those ends meet. But I haven't heard anything about your support services. Support service is part of the human right. But how about the equipment? We cannot get into the telehealth unless we have the equipment. Do we have the right equipment to fuel this thing through, to get this thing through? That's my worry. Because I know that you don't have a mechanical engineer in your hospital, and that's one of the main things that you need right now, because a mechanical engineer knows the ins and outs of how to put those things together based on what the requirements from you guys, the doctors. Okay, you order equipment and based on your specs and those things, but the mechanical engineer has to put those things together, make sure it works. So you can use all the telehealth, the expertise that they have from Mount Island. I'm very happy for the amount of what I heard. They said you have 41 RN, 32 LPN, and 45 NA. Okay, did you say you're trying to get the physician up to 90, or we already have 90 physicians? Dr. Latua?
Yeah, we're trying to get our physicians up to 90. Yeah, we have got a few days already on the pipeline. It's just a matter of finalizing their travel arrangements.
Okay, you mentioned about that pipeline you're talking about. I want to know where the end of the pipeline, where's the starting from the pipeline? Are we getting from the high school all the way up for our nursing? Because the doctor, we don't have that over here. We can get that from our island. But the nursing is what we need. How are we going to connect this pipeline to get a comprehensive continuation of your sustainability of our nursing on this island? You're bringing those 50 nurses, or this is from the media though, and we already have another 20 that's in a hotel right now. So are those numbers count on the numbers that you said that's for Kosimau? No, those, okay, those not, okay. So we still have, that's a lot. That's a lot for us based on what we have in the past. So you're doing a good job, but I'm really worried about how this pipeline is going to connect it. I want to make sure when this batch is finished, is there something come behind to fill the void? Are we already working on that?
Yes, we are We already met with the Director of Nursing at the American Samoa Community College. The permanent solution to the nursing shortage on this island is our local nursing program. And this program needs to be supported. You know, we will be putting together a plan and a proposal on how we can improve this nursing program so that it can produce the number of nurses that we need, you know, in the years to come. We need to develop a workforce development plan and try and put together something in place to bring in our local nursing program to meet that workforce development that we have 5 or 10 years from now, so that we don't have to keep recruiting nurses from off island. I see no reason why we are recruiting nurses from off island when we have a local nursing program. This is the program that needs to be supported and to be developed. We need to help support the manpower. There's only 2 or 3 full-time lecturers in this nursing program. We need more of those. We need more rooms and more equipments and more spaces in order to run this program. If we have to have long-term sustainability, we need to develop our own. And this is what we need. Recruiting is going to get expensive in the years to come. And we will be competing against the top nations. United States is forecasting a shortage of 300,000 nurses by 2030. And that is in the US alone. And the nurses, the market that we have to get nurses from is mainly from the Philippines right now. So right now the US, the UK, you know, everywhere else, they are getting the nurses from the Philippines. We need to develop our own local nurses, and we are working together with the nursing program director here at ASCC, and we will be putting together a proposal on the improvement of our local nursing program so that we can meet our needs in the next 5 or 10 years from now.
Well, I appreciate what you said, but you're leaving. But Director of Nursing, please follow that through. It's very, very important to us, and also our CMO. Okay, I think to respect to my fellow senators, that's enough for me now. Okay, I'll turn it over to them. Thank you.
Chairman Malamongo, Chairman of Committee, Dr. Dual CEO, on my family, my family, CEO Ledu, may I ask you, are you leaving for good or you're coming back?
Let me say, you know, I am not leaving now. I am here.
You're going to leave next month, huh? Are you going to come back or what?
My leaving is not confirmed yet until the papers are finalized. If I have to leave, I will not leave for good. This is where I've been living for the last 20 years. This is where I raised my family, and all my children attended the school. My wife worked also as a nurse at LBJ. So I will
for you. Thank you. So I was telling you, when you leave for good, it's no use talking to you or all this thing.
No, I will not leave for good.
I'm at a loss, CMO. When you said you try to improve the services, add services, and try to cut off the waiting time of people coming there, and yet you don't have enough nurses and doctors. Who's going to do this?
Yeah, we are working right now. As I said, we have already, we are right now in the process of signing a contract with a nursing agency that is going to recruit 50 nurses from the Philippines, and they will be here in 6 weeks. 6 weeks from the date that we sign our contract with them. These 50 nurses will provide a relief to our nursing shortage, together with the 20 Fiji nurses that are here. They should be finishing their program in July, and we are looking at having at least 60 to 70 additional nurses that will come in at least by the end of July. That will help bring up our nursing shortage. As I said, these are all temporary solutions, but the permanent solution, as we are doing this, we should also be improving and developing and planning, as I said, on our local nursing program. This is the key to permanent nursing shortage solution.
Dr. Chimo, do you have a long-term plan to try to solve this lack of nurses and doctors?
Yes.
I don't like you to hire from the neighboring islands. So some plan to encourage the people of American Samoa, patient care for nurses and doctors.
You're
you
right.
have to start now for another 10, 15 years. We don't have this problem again.
You're
Do you have a long plan? I suggest that you talk with the chairman, all of you discuss your ideas, what to do.
Yes, we do have a long-term plan. As of now, we have 7 of our local students at the Fiji National University. 2 of them will be graduating this year. And this is the program that we started 6 years ago. But we are also working together with the high school and also with the science School of Allied Science at American Samoa Community College to try and get our local students a prospect so that they can get into the medical training program, and we can help them develop and guide them so that they can do their medical training and come back and serve our people. As I said, we have already started that 6 years ago, and we will be seeing graduates coming out of the Fiji National University at the end of this year.
Thank you. We wish you all the best. And one thing I really want to see you solve is to reduce the waiting times of the patient come there. I really want to see that you can do this, cut off the waiting times. Some people come real early without the breakfast, and they go home, especially older, elderly. But I really want to see you solve this problem, try to reduce the waiting time in the hospital. My question for the chairman. Ola say if I'm a mole, we are saying, ola no kupu ya kam.
Ole sunga ya sale panga o whailava lang kalvai. Ola e whainga luengare i el fomai. Ola e ngā lue e le whaaswanga la o mai i le fomai whaku lea le cardiologist le e ngā lue pakasi mai o kamo matsunga le fomai ia ma fomai lango i le outpatient i le ngakamakua.
Alay fanga o kong yang fo kuanga fo mo ka problem come up alay need ko lang advice.
Yeah, o solulu mai fa ye fongo ia o vole sunga ia sale panga ilang fa kuanga.
Ma fo ma ku senga. O sile ano la ko ngonga le mai la nga. La need ka ko wa la he's doing fine. La simaka po ale udur kama. Mga umia awal fa ko ko nga kama ngi o la no mo yo ko kul manu. Ay me ni dai fa sidi ay ngan lu fa. Ya sa fo ko nga fa kel mo ko. Thank you.
La fionga senso magli Sir President.
After Chairman. Tilo o babel tato tine tele la bisile. More, Dr. Ledoux, I'm going to issue a stop order. You're not going to leave this island until you fulfill all what you just said in front of this committee. Anyway, thank you for your service. It bothers me because you are doctor. But I thought to myself personally, you're wasted to be in a CEO because your expertise is right here to serve the people, the patient. That is the problem we face. This is not an issue, I mean a new problem in this hospital. Ever since I was coming back in 74, we still have problem at the ER. It's a lot of time people sitting there waiting for a doctor. And the excuse, I don't know what it is, but it's not enough doctors or not enough nurses. So what are we doing to remedy this problem? Is my first question. Because you say we're going to provide, and one of your code is provide service which is not available here on the island. So if this one of your code, what is time frame? This is one of the main reasons most of us go off island, because we have our primary doctors over there. For me, especially, I have mine in Shrub, and I have a cardiologist over there, and I have a urologist over there. When I call, they're available for me. And when I come in, they only take 5 minutes before I go see them. See, this is the type of service that our people here is not getting it. And it's been there for ages. It's not something new. And we keep talking about, we're going to do this, and that's it. What are we doing? What are we planning to do with this problem? The same thing, Dr. Yokamo, patient, when you go there in the morning, outside in the tents already flooded with people to see him. And this is what really hurts me. It's good to have this, but when are we going to implement it? And what's the time frame that we're working toward there to accomplish that goal? We cannot establish all this big goal, but we need to call like the short term, long term. We work toward that one. Because like I heard you're going to leave. It's nice to hear what you're planning to do, but who's going to fulfill it? Maybe you write it in papers and you set it down there, but when you leave, somebody else come and change it. And this is the problem. I admire you, Dr. Tuyursenga, but you work a scholarship from this island to go to Fiji and work. You come and go to Manua and serve. You come back, what do? You went on private practice. Why? That's my question. Why didn't you stay and help in the hospital, provide that service in the hospital? These are the things we need to look at. And to me, I see your hands going up, Dr. Shumway. I'll come to you. I'll come to you. But we have problems with nursing. We have a director of nursing education over here. I think it would start in 2000, during Tongiola's term, when he was a governor. And I was a budget director and a tracer at the time. We implemented that student there. But I found out about over 100 nurses graduates from there. Where are they? Where are they? Some of them moved off island because nursing salary over here is not fit. Where is attractive over there, they move. And what are we doing over here? Are we compensating them? You talk about money, but the Samoan person, people, sometimes you don't really care for money. We care to serve our people. This is a small community, service. But if the morale is not there, that's going to happen to create. So my question is, what is the problem happening in the hospital now? Have you really identified what really is the problem, and then we're trying to solve it from there? I heard on the news about all these kind of going on there. I'm not interested to hear those things. I want to interest, what is you planning to solve this problem we have? How are we going to solve the ER? Like Senator Utu say Saturday he went there for 6 hours. And here's the thing. And I appreciate what you're trying to do, but let's show our people it's coming. There is some money being given you for the new hospital. I'm a member of that committee, but now I heard you guys go on it. We are the stockholders. I don't know what's happening to that committee. Tuyursenga knows I'm in a part of that committee. And we gave the hospital people over there to stop working for the blueprint. They come back to the committee and say what, all of a sudden that committee is gone, I don't know. I'm not, if they don't need my help, fine with me. But we need action. So this is my concern. It's what's going on in the hospital between the board and the people there, but who's suffering? It's not you guys. Are the people who are the patient, who are our people. They are suffering because it takes longer to stay in our ER. It's no improvement. It takes longer to see a doctor. I appreciate this doctor, Dr. Carp from my church, to come down here to serve the people. And I hope they will continue to do that. But hearing from all of you professional level on this, you have very good planning. And I wish that our people will see the day those planning will be fulfilled. Hopefully that new hospital will come in, but I still have the question about it. If we're going to bring a cardiologist, hire them. Do we have enough patients for that cardiologist? If we're going to hire urologists, do we have enough patients for that urology in order to pay? Otherwise, we're going to look for money to fund the hospital. So I'm just letting you know personally my concern. And some of the people who connected with me and let me know their concern so I can bring it to you. So you can look into it. And I feel sorry for the people. When they come in the morning, 6 o'clock in the morning, they didn't leave the hospital in 6 in the evening. Like I talked to you before about my wife. She's a wheelchair person. And I'm glad you did solve that problem. I don't know whether that doctor didn't like me, but I'm sorry to do, but he told my daughter, tell your father I'm a good doctor. I say, yeah, I appreciate what it is. But this kind of situation, I'm not speaking because my wife is in a handicapped person, but for all the Samoan people in that situation. I hope you hear, I'm voicing the voice of our people. You are in the chair, you are in controlling. And how do these people? That's why we are here. We want to let you know how we feel, so you can work from there. So that's my concern, doctors, and all of you in the hospital. You're trying to bring more nurses on island. How long? This is another concern I have. You have these nurses from Fiji going to train over here, and then when they get the RN, and then maybe we work for 2 years, and then they leave. And then we back to square one. And I hope Amu's listening to me. He's a good friend of mine. Sometimes I scold her for not what's going on. But that's how I am. I voice what I have here for the voice of the people who contact me and let you know that this is how they feel. So thank you for your good work. I hope you continue to look for more way to improve that. Waiting people in the ER is ridiculous. It's very, especially the old people sitting there early hours in the morning, like 3 o'clock, and they won't leave the hospital until late. To me, it's no excuse. It burns, it hurts me. So thank you, Mr. Chairman. Thank you for your time.
Sui Presidente, bole saunoanga matako fie fautuanga le lei whaafonga ia ele. Tatu te itai bel whalpai malo whaftai fautua. Ole langua le to tele stebi fie tu watu lava loa pe auban saunoa le fionga le. So intoa ia le pule. Lai pule. Ile suga le fo mai le lava san saunoanga le suga ia Joseph Shamrock. Ya umale. Fisili ya wal fisili to lua tatu fisili on to la doy sungal for my city CMO
after actually la firma mit dem natural firma te committee a umil tato tao ya o tau inshallah umil tato tao o tau on tau puneta ya o la u sili fatu to la sunga to senga. I have a lot of respect for the doctors and the nurses because they understand they're professional. And the problem I'm having is not with the doctors and the nurses, but I have a problem with the board of directors. I've heard a lot of good stuff from Dr. Ledoux and the CMO this morning. I would like to advise you, the chairman of the board, let them do their job. Let them do their job. It's not the board's job to direct how to run the hospital. Your responsibility, it should be to support what they do and support what they recommended to you and the board. It's not for the board to run hospital. And that's where we run into problems. When the board tries to dictate what the CEO and the CMO and the professional that knows about the medical conditions and the status of American Samoa and the community, you should be able to listen to what they said. Ala ka ui o sau noa ngale, whionga sing toi a kua moa. I fo mai, kama whanau o kako o lewa ngā lue, i mauka ngasi. Upe masangele kungu e siri muri mai a mo mai. E loe awe, kere ngai kam whangau makako waro la kungu o le, e ofai mai kai fo mai. You should be able to hear, ask them what they feel, their opinion. And that's where you should come in. You're supposed to help them out, listen to what they say, and hear what they have to say. They understand what we need, and they understand what the people of American Samoa need. You just heard from Senator Mangalei. It states all what we need to do and what we would like to do. The CEO and CMO, and also the board of directors, to address the issue, to convey the service to our people. That's all it is. Provide better service for the community. Yeah, but I am saying this because I know every CEO, every CMO that works in hospitals want to do their best. We've heard a lot of good stuff from Dr. Ledoux this morning and the CMO. Let them do their job. Your responsibility is to support them and ask their professional opinions of what they should be able to understand what they're saying. You've been there for quite a while, and you should be able to listen to them. After them.
Ole, mao la fioka mao. Ona, atule stala, bits for but.
Ole am no, atalo fat foi, sungai mon mau neita ao, wa elese vesili, au fa fonga au tu sungai tu saio. Fau tu angam tima ingon neias, ilo wala te tonunga. Ole ngā lue fa atasi o le tau poe, ole matanga o fia ngā lue. Ngā lue fa atasi, ma waise mele, e malosi fo ili nā. Lewa ta oto atu saunanga ta mamuti nā le atunu. Ia tau sunga wapeo tau wau tau sira pia, se luma na i manuia o Amerika Samoa mauna tangata. Fatino loa. Ai ua na le tele utala e le se me fatino. I le awa malwhalo alfa teila o fionga te komiti.
Leo tu tele so tato teibi. Ai ele tato luga mal salo to teimi o nisi o to tato te mafutai o na tulanga o suiga. We understand that some of you will end your term with the board at the end of this month. And Olfia, o fioga tia, te bama tua. Pel dei tebi, te batwele ava noi la o fioga. Se sau noia, I se whaftai hoi, au au nei o le ale tue tūbau. Le ale, la atu ua le whalwai ma members of the board, as we ane nisi. E le imaua se tonu o le sunga le tōna sega, seu stevi, o le i o ieli fifiliga. Ai mo nisi, ia, pe o le whaftai, tinga ia, Jean ba, ai. Sau doi o le tabam tua, tulou.
Ai, dau whaaroaro. Leo a mai a kia ue. Peska ko whaafkai e warka ko mafkanga ni kai auma. Shunga ri fo mai ma, ka mai kai fo mai, ka usi mai. Ere e wakuas whaafkai. I eiro karpongu ngai. Pe iao mea kau kupe le o lava. Le o lava mea kau kupe e hai ai ma mai ai fo mai le yak e le bele a uno ko nga se ama lo ko fako kia a e pe o kulanga nga de ai le si nga fai kaua le nga kai I fo mai a o me fa ki wai nga ruenga fo mai ele o lava me fa ki wai ko nga ruenga pe yo le nganga nga an ngai kai au ma lo fa kai lo ko ka ku ma lo le fa lo longa ko la se si uso fo ma lo ka ku ele ko ngia America Samoa lo ka ku ma lo ai e ko ngi mai le ku le lang a fa kai lo ka ku ya America Samoa mo ka fa kele la nga luenga le ya kongo ko suma fo skai ya ya singa ngalu ya ai moria ku le nga fa kai ko sunga ali fo mai ka fo mai ka ko si mai lo ko nga luenga de fengo fie fenga yo la langi e muy ya la si fie le ku nga luenga le lo ko faking e le kongia la le ko vanga ma le fainga malo America Samoa le af kongi mai langi malo fa kai e kula mai o skasio alo le ngu ya lo ya sio uso sa le panga ka kuanga sa le panga ya mo fa nga uma la tunu e fa mo popo leima anga due fakasi ku fakasi akia fakasi o inga e maro si ai se mea o inga fo e mangu ai ka nga lo fa le kua lo ko so fua a wale ku I fa mangu ia le kua lo ko so fua o fo mai ele lava ko kongi a lo ko wo fo le ku mo ko loko a ko o ko Samoa mongi ma ko ka kua malo le kua la sisila si mamao fa kai fa pe foi fa ku si fa kai nga lu I de fengo fi fenga le ka ko mo da ku we a o la la va ko ku inga le ku o malo ko fa ma yo ngai ma ko puya a fai ko sun muli ya langi mal ngai ku malo o mai foi ngai ku mo ko le nu ya so fu leim so fu malo lo le fi ngeima mo ngeo le tunu yesi ma ko fam kalanga le mangier ka ko mafkanga fa kai
te tele mo fa manuanga e saudo ye chama tu le ta ai menato atuil de ave lo tas la former governor togiola tu la for Italia pa tu balita ya bo e saudo pele ai so ulelo tato
after ya tu lo fiona tata komiti e mana mia o sei tu la e me fai un tolo tato fono sfultas after tere la fiona tata komiti mo la no ala atau fato petope atu nai fesili malangona e tu sa o ta upo nei aso na o ta ua si mau o lo sunga leo o fatonu I le tulanga o mea tau tene tausima o le Director of Nursing se e ta umai le maota po le ale faafita uli e te sila fia mai lo tulanga ma mafu ai le tele o tene tausimai o whaamawai mo ese ma le whanmai
Sai mo le siri o tala foi man falo alo o le tato mo tanga sengase e se lauri mas fulu ia moenga capacity o le whanmai o te mi nei o e fast food tasi tato RN solo ia nei Ai mana o mia e whan mai, nisi RN se ono se fulu.
Ono se fulu.
Ono se fulu.
So mana o mia la le se lauma le tasi on staff.
Right.
Ai na alfasu tasi le iei nei.
I na alfasu tasi. Ona o le tato mautanga se ngase sila fia fo iolo i lalo whamal malunga le CMS. Ia o tūlanga o le o condition of participation. It's a tau ravana i ele RN i sifi. Every shift, it's a tau na i ele RN i supervising na ia ngaluenga LPNs. Ia me se fo isi unlicensed personnel. A le tūlanga fo efsilingia i le to tele wa o ese atu. Ia e o to tele o teine o mai Filipino. Ia wa umala to contract. And of contract, ia o ese atu la to fo i la to atu nu. Ia o nisi o tato.
Nei se mafuanga o le tue whaafou ai kong kalatina ina ia maua le au whaimana o mia mo le tau singa o le atu nu.
E whātala noa ina le toi whāfou wina. Ia e ia isi vai ngai toi whāfou. Nā toi leo le whātau sanga. Ia pe o le limiti nā le teimi nei o le whātau sanga. E tasi lava steine mai o e Filipino. O sfut whāni on tau sanga o lo onga lue pēr. Ua umafo in toi whāfou ia i lana contract. Ia laua toi no fofo ia. Au nisi tātou teine lia i nei le
Hea teine Samoa, o le ale mafuanga ua tele ai e teine Samoa RNs ua o ese.
Ia o te manatu o no to tongi la ia i le tato mautanga se ngase.
Nga le tongi o RN a mata.
O le mea lea fo le swinga fo lea na whai atu nei i le end of last year.
E le board le iei nei.
Yeah. O le new entry for RN se tolus full valu afe o lo ye teimi nei i le tau sanga.
Al senior RN so le ale tūlanga le iei me le overs full tau sanga le service.
Wa limas fulo la wa ye teimi nei ia. O le tūlanga na lo e o le proposal e na tu watu i le ruma i le board ma le CEO fo i la wa mawai atu.
O kuri.
Ia o peo wa lava tūlanga ia o le ave o le proposal. Ia au tūlanga i tupe ma me whaatino i le proposal. Ia sa wa mai.
Ia mai le mota le proposal sa e ave i le whatautainga al whalma.
O le mea lea na ave au ia o LPN sa amata atu i le luas fulu valu. Pela o ye teimi nei ia a RN se tau nei fast fulu afe i le tau sanga ia lato entry fo i leo tangata fo ian faso solo atuala ia i lunga i lo malama my years of experience ia my credentials.
Utalia la el portfolio le tūlanga le sa e tarsanging.
Ia o le teimi nei ele i maua mai se tari. Ele maua mai se tali mai le board, ia me se fo ile acting CEO o ile.
The concern I have with the nursing is you can have an excellent nursing program to develop, but if you don't take care of the nurses and their working conditions, it's worthless, totally worthless. So you can have the best nursing developing program without the right conditions, the right pay, and the right benefits for nurses. That program is worthless because they're going to graduate and leave us. And I was listening to what you have said about developing it. I've been in the forefront of developing the ASCC program to become, but it just does not jive with conditions at the hospital. As soon as they hit the hospital, situation just gets too frustrating. I'm aware of another RN that just left last night because working conditions, overtime, putting that person 12 hours, 14 hours a day, That's criminal. Put a nurse to work 14 hours a day, taking care of patients. You're putting patients at risk, terrible risk. Whaftai atu, ia te oele, tina, tārusia ia, angai pe luma le. Sidi molo sunga malo. Wato neli tau sanga talu ona se etil no fua ole fono whafoe. Ili tau sanga lea wo ye se fuafuanga po se plan mo le redevelopment ole whale mai iona matata ese ua o whatulanga nei. Is there a comprehensive plan for the redevelopment of the services in the LBJ Medical Center since you've been a chairperson?
Okay, mole sili. Ole lava.
Do you have a copy of that plan? Do you somewhere? Is there a copy of that plan? You just said yes to my question.
Yes, there's. See, if I could copy there.
That's the plan? One page?
Well, it's just kulanga le o le face le iai o le ngai lava inventory le kele o le operation a le ua makanga o aku le clinical o le inventory le o le leasing ai e o luma o le clinical o kei kausi maia o lo e kaungu o mai lako ke overhauling al ka nursing services. E so swangi le sunga ia I ka kei fo mai e ngai. O le inventorying o le operation. Leo pe ko silfia leo o ia kulanga ia swinga. O ke le ia o le simele polokai le HR. E kumule poku ki pusa se kulau. A waku application ka ko ki fo mai. Ke leo ki fo mai e ka ko apply. E loku ngo fo ki pusa ni. E le updating ale. Ia le HR. Pe ko fia. Ia application ia. O certification ki fo mai. Wo o lai senge o la ko kedi. E ka kaunga update te arua I lunga ko e aku ungo fo ki pusa ia. O le ngalua ki ria ngā le e poloka ia le aru luma. E me ia. O le HR le alau ia makoule ia le kupinge aru wina. O lai pisi le kaimi ngei makrau kuanga. So mei kaunga so swangi. Langa o le ale sa o ia kuichancho sia. E le sa o le kongyo kei fo mai penga sili kei fo mai o kai Facebook au sanga. O le nganga ia le po kaunga I lunga le ongo sulu.
Exactly.
Yeah. A le singa ke le inventory le plan la le ke sa ngoi. O le lau a makango o clinical. A ku pe sili le sunga ples kengi le kele o ka maliu ia o mea mako. Sao. O le whangongoanga. E le oiloa e mako. O le hale mele maliu mai ei. O le lai fie wo sa whapeala a so sangi le sunga ai firi. E mako investigating le cause of death ngai. O le o le sanga makaile le ainga lea. Awa ko iki a kosu percent o ka maliu from Il masinga. It's almost 30% o TOA maliu le o mai. E ho I whafol kuranga kaunga Yesu se kaimea kaunga meska kai de I maliu mai foi kaunga Yesu suanga.
O la fasili lena watu fia mama lama lo usui po ua whata oto se ala fua mo le tau whata utenga o le toe wha fo'i o le whale mai I lana service e tala whia ngai ma le
pui o soifua malolo ino le tunu. My question is specifically, in the 1 year that you've been chairman, have you developed a comprehensive plan that guides the redevelopment of services in all aspects in serving the health of the country?
Yeah.
And it's quite obvious to me that you don't, and you haven't. And if there is, I'd like to know, because that is an important.
Yeah.
This one here?
The PowerPoint, you have it.
This one?
Sure.
You have it.
This one here?
This is LBJ and this is LBJ
To me.
Avenue Hospital.
And who are you, sir?
Marurua ku pin mangano ko ile sungangi ya shamoi ole foma ile o le poma sile chief medical officer o Dr. Joseph Samway okay marurua koi no sum.
Okay, yeah, all right, then. Right, this is it. When has this gone through the board?
Yes.
Is this a board-approved plan?
Yes. I will.
Because if it also includes the new hospital, which I am terribly worried about. You're so understaffed at LBJ as it is with doctors, nurses, and all the other necessary services, and you add another 40-bed hospital. How the heck are you going to manage 190 beds? You can't even manage 150 beds. What are we going to do? Does this plan address that issue?
No, that's just part of the plan.
Well, we're building a new hospital and there is no plan for it? My gosh. We're headed for more problems.
Yeah.
They have it.
Se moli mai la sunga mal komiki ia le lane katsanga ilo.
Lelena mai le fufuanga lea na ia malmalama wae o matu fautuanga ia watu. Ia I kaipa ia o pusa ia twarai. Na le watu o fautuanga ta atia le pusa ia nofo ia le pusa le aise me tupu le tau nuu le fufuanga ia o ngapea ia le pusa mai mau te imir se ngake ngai kaya. Ta fai o tūlanga leo tātou. Ai langa ua tātai mi o te longona tau overlay titi fo i o minute. Ai no o faisi o tuai mai a se manu o tātou te whafsanga i o tōlu tūla. Na manino lele o tātou mata upu. Whaftailo o whionga le, te komiti mo le avanoa.
Table, very important input this morning from our Governor Tongi Ol Tula Folo and for Senator. Siap tala FIFA yat fa bol-bol. O ta ua alum fa da o sa bo. Ile aia se fa boy e fa bai o alo sa bo. Fa peda fo se la goda sa ia. Lo o fa ya tu tala tu lo I tangata ia bai fa fo. Wo o fo ia to figa. Lo leva nei sa mo ton. E tau tala tu le ava bal fa lo. Ta ua fo le suga ya sa le pa. O leva na e tau fte. O leva na e iu. O te le fefe. Alo i o Samoa. O ala to bena fai. Tu lo. Langa te tilo iei. Ma ova ai iei. A fai sa ungoa I to e gata gata le sa le paga le suga I sa buida la fioga lo e ava I takata PCC pe nofo e ava I ten for bai bai o na loka lo I da me uba le se me move o ila ma fuai lo e ma fuai ya lo tatou na tu atu e fai galwe al pela le I tu lo se o manao ya lo yo sa boy le la o fai to figa ia
le lau o fa pe fa logo foi tala tu pe le usau bai le e mau amos ni tala a fa no o halo la tu ia le uma se usu egal bele a faila solo buai i alo la tu ona fa pe ona ngalu lue le se me faia le foi se me ngai oi awa e ava uma tanga tele fioga ya sala pa suga ya sala pa ole e ava foi le fioga ya fa buidao al fala bla ole be la la lo tsoye ato ole no fo ya le felma mele tal ole tau tala blo wava blo fa la le tabala tu na lo to sa doanga la blo to fi de galo if fa fo ga ye wa de ya si be ba lo bo wa taba tida ole atu du o de le o te whadara tatu le tūlea. Ia tere tatu upu ia tatu whadau, tatu walo whadau. O lo tu ia tuere kalwa. Ia tere tatu upu tu sao. Le wawa lo whadau tere. Lo whale tua so al bai. I im ta upu. Ai, whabria le tua. Iau tau tabaha ti dao la turu. Amalia mo pelo tu so fu le si ona na lo fale tu fale aga so aso church so fu bele. Thank you so much members of the hospital leadership for being with us today. We will schedule another hearing in the future. The Senate needs more. Need to hear from you more in the future, and we have more questions. And thank you so much for this morning. Yeah. Appreciate it. God bless you. I'm shaking your hand.
Okay. Yeah, I'm going to okay. Bingo Samoa o le o mai o le apala vale alo le Samoa i whaukuanga, whamangianga, mapopo inga me au kūka māma ki ngā lako. Mā ua sulmuli fōi lo u kaukua, lo u kaukua ma le nganga whakai. Ea fōi se anga po se kala ua se ia whamangala mai pia kari e mangsinga le soare, le mafukanga. Malu parwa kiri ngo peka kule ulma malo si fa kai ya